right, so today we're going to be talking about stress management, inflammation, and irritable bowel syndrome and irritable bowel disease. So we're looking at different lifestyle factors and symptom management for these two conditions. A lot of people talk about them interchangeably, but they are two separate conditions, and we're going to be talking about that as we go through the presentation. So prevalence of irritable bowel disease, there's 270,000 people in Canada and over 25 million people in the United States that have been diagnosed and live with this debilitating disease. Actually, interesting fact is Canada has the #1 prevalence out of all of the countries around the globe for irritable bowel disease and irritable bowel syndrome. And the researchers are not 100% sure of why. So they're looking into that to determine why that is and what needs to be done in order to help people and be able to figure out when they're testing who has this disease quicker. Because I'm going to go over with you also the different kinds of testing and what you have to do in order to determine what is actually going on when you're being diagnosed. So the definition of inflammatory bowel disease is a term used for two conditions, Crohn's disease and ulcerative colitis, that are characterized by chronic inflammation of the gastrointestinal GI tract. Prolonged inflammation results in damage to the GI tract. So again, I'm going to be talking about both IBD and IBS and how they're different. So inflammatory bowel disease is actually more, I don't want to say severe, but severe than IBS when you're talking about the two different conditions. So in the picture below, you'll see that there's a picture of the torso and the intestines, the large intestines, the stomach, and the small intestine. So really, when you're talking about diagnosing IBD, you're looking at the different quadrants. And that's going to tell the physician a lot about what is actually going on with the client. So if you'll look over to your right, you'll see the right upper quadrant is the gastroduodenal and Crohn's disease. So you're looking at that up here in the area right above the right lower quadrant. The upper left quadrant is ulcerative colitis. The right lower quadrant is ileocolitis and ileitis, and the left lower quadrant is ulcerative colitis. So sometimes when a patient comes in, they're presenting with stomach pain, and it can be either in the upper or the lower quadrants, or it could be a mixture of the two. So it could be some pain in the left upper quadrant or the left lower quadrant. So then the physician and the different teams that you would be working with have to figure out what exactly is going on. Is it IBD? Is it IBS? And individuals can actually have both of them at the same time. So it's very important to get tested. Even if you start out with having some of the symptoms and they're not very severe, you should get checked. So that way you know what's going on so you can be treated before it gets to be more severe. Sometimes it starts out to be where you feel the urge to go to the bathroom, you feel a little nauseous, and then it can work its way up to you're hospitalized, you're vomiting, other symptoms are going on. So it's just important to be checked as soon as you can, just so you know if you have IBD or IBS. Comorbidities for IBD and IBS. So as we talked about, people use these two terms interchangeably, and we're going to start to see how they're different. So irritable bowel disease, individuals who have irritable bowel disease are more at risk for cardiovascular disease, respiratory disease, cancer of the colon, arthritis, weak or failing kidneys, liver conditions, and ulcers. So this is why it's very important to be checked and diagnosed so you can be treated appropriately for whichever condition that you have. As you look at IBS or irritable bowel syndrome, you're going to notice there's different comorbidities. Individuals can have fibromyalgia, chronic fatigue syndrome, schizophrenia, panic disorder, bipolar disorder, gastroesophageal reflux disorder or GERD, and functional dyspepsia. So you see how the two are different, and then if you have them both at the same time, you can actually be going back and forth between the different comorbidities, or you may have some and not the other. So it really depends on what your body is going through at the time and what symptoms you're presenting with. The other thing I wanted to talk about is inflammation, because inflammation can actually be seen in IBD and IBS. So again, it's important to be checked because some of the symptoms actually mimic each other. So you want to be able to separate the two. So inflammation can actually not only be in the stomach, but it can also be systemic, meaning that it can be the joints, the skin. It can either feel like an achy sensation, like your client feels achy, or it can be like a burning or a combination of the two. So it's very important to note how your client is feeling when you go and train them, because how they're feeling is going to depend on what exactly you're going to be doing with them for that specific training session. And it could change from training session to training session, depending on the symptoms, how they're feeling, and if they're in remission or if they're going through a flare. So we're going to talk about that too. Prevalence of IBS, 1 in 5 Canadians have IBS. Again, it's the highest rate globally, and that's for both IBS and IBD. Canada has the highest rate. 10% to 15% of individuals in the United States have IBS. So as you can see, you can actually gain some clients with this population by really knowing how to put it out there and promote it and talk about it. Most of the times I feel like people don't talk about this because it's either embarrassed or they feel like this is something that shouldn't be discussed. But you'll be seeing through this webinar how individuals can manage their symptoms. So it actually is really important to bring this out to the forefront, especially after COVID as well, because some people do get these symptoms, and they can also be helped with exercise and lifestyle and diet changes. So if you're looking at the picture below of the torso, again, you're going to see the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. So IBS is typically found in the small intestine and the large intestine. So if you look, you'll see the arrow pointing to the small intestine, and you have the large intestine. So this is where IBS is usually found. IBD can be found in different parts of the GI tract, the intestines. So that's why it's important, once again, to be tested to rule out what's going on. And many times the client or patient can't even tell exactly where their pain is coming from in the stomach because it's so volatile. There's just so much going on. It's really hard to tell where exactly it started and what's happening. So the role of the mind-body fitness practitioner. When you're looking at a client and you're working with individuals who have IBS and IBD, we're not only talking to them from an exercise standpoint, but we're also looking at them in a way about stress. So how is stress helping this condition to flare? So like I said, I was going to talk about flare-ups. So when you're working with somebody who has IBD or IBS, you want to assess the individual, their fitness and their stress level. Then you want to classify the individual into a category depending on how stressed they are and their fitness level. So you want to classify them and categorize them. And you want to help clients to create a mind-body program and or fitness program depending on the course that you pick and your credentials. You want to monitor the progress throughout the program. And our main goal with this program is to stop the stress cycle before your client has an IBD or IBS flare. So basically, stress can make IBD or IBS flare. It starts off with being inflamed in the stomach or the intestines, and then it quickly escalates from there. So then they start getting other symptoms. So if the stress is going on long enough, they could end up with, if they have IBD, they could end up being hospitalized. IBS isn't as severe as IBD. So IBS, they could just have worse symptoms. And the problem is with a flare, individuals can be flared from 2 weeks up to months. It could take months for a flare to go away. So it's really important to try and help the client before their stress gets too out of hand. So this is the chronic stress cycle. As you can see, you have the stressor, you have the reaction to stress, wear and tear on the body and organs, reduced optimum health, increased sensitivity to stress, and chronic disease. So as a mind-body fitness practitioner, your goal is to help the client before they get to wear and tear on the body and the organs. So when you go through the different program techniques, you will be able to help your client and hopefully stop the stressor before you get to wear and tear on the body and organs. Because once you get to the next level, you'll see that's reduced optimum health. That's when you start to get into the flare, and then it kind of goes out of control from there. Next is the multidimensional health promotion and fitness training model. So the Stress Management Institute, we came up with this model for individuals who are training their clients. And you'll see the pyramid, the picture of the pyramid. So if you look, you'll see the bottom of the pyramid is health promotion. Health promotion is the base of the pyramid because individuals need to be educated on exercise and how it can help them through workshops, flyers, classes that you develop. So it's important to get the word out there and to let people know that it's okay to talk about these two conditions, as many people have them, as you know, but they're either, like I said before, embarrassed to talk about them or aren't sure of how to get that started. So if you have, say you have a class that you developed and you have different conditions listed and you list IBS, IBD on there, they'll be less optimal to not want to talk about it because it'll look like it's more accepted. It's okay to do so. And that's what we want. We want people to feel comfortable when talking about these conditions. The next level of the pyramid is the 6 dimensions of wellness and 12 dimensions of stress resilience. So again, we're looking to help individuals to stop their stress cycle. The piece of the pyramid above that is health behavior change. So as we know with all fitness programming, diet programming, health behavior change is very important if you're looking to make lifestyle changes. And this is also in the case of these two conditions because the individual, once they're diagnosed, has to go through many lifestyle changes and usually at once. So it's not like you have time to change, you're changing quickly. So you want the individual to learn more about health behavior change and get them on a path where they're going to be successful. The next part of the pyramid is self-care activities and daily living and holistic approaches. So self-care is very important when you're talking about IBD and IBS. You really have to pay attention and listen to your body and know what's good for you and what's not. Sleep is very important. Individuals want to try to get 8 to 9 hours of sleep a night if you have these conditions. Sleep can also cause stress if you're not getting enough sleep. So then you start the stress hormones and then you can get the inflammation, you have the flare, and you can see how it goes from there. The next piece of the pyramid is the chronic disease self-management. So again, you want to make sure that you're helping your client to learn different techniques and tips on how to get through their day. So an example of that could be maybe somebody who exercises in the morning starts to notice more symptoms than if they exercise at night. So just figuring out different tips and techniques can definitely help your client to manage their symptoms. And then the tip of the pyramid is fitness. So fitness is obviously an important piece to helping control symptoms. Now, when looking at the pyramid, you also want to note that there's no more important piece than another, but you want to make sure that when you're looking at these, they build on top of each other. So you have health promotion, and health promotion can also be seen as a way to get clients. And then, so you want to build their resilience as you're teaching them fitness. So these pieces of the pyramid may be given and taught to the client in different pieces of the pyramid, not all the same at one time. So you could go from health promotion to starting to learn about behavior change, depending on where the person is in their fitness and wellness journey. Okay, so next we're going to look at breathing techniques. So breathing is very important when it comes to stress management. This is also the case with IBD and IBS. The two main breathing techniques for these two conditions are diaphragmatic breathing or abdominal breathing and alternate nostril breathing. So both of these were noted by the University of Michigan in Health as two breathing techniques for both conditions. So these breathing techniques help to decrease heart rate and blood pressure, decrease muscle tension, decrease the stress hormones, and strengthen the immune system. It doesn't mean that you can't do other breathing techniques with these individuals. They may want to try other ones, and that's fine. These are the ones that are shown to be most effective for this population, for these populations. So signs and symptoms of IBD or irritable bowel disease. So the client could come up to you and say that they have abdominal pain. And again, they may not come out and say, I was diagnosed with IBD, or I think I have IBD, but they may tell you that they have abdominal pain, diarrhea, gas and bloating, loss of appetite or unexplained weight loss, upset stomach, blood in the stool, fatigue, fever, itchy red painful eyes, joint pain, nausea and vomiting, skin rashes and sores, ulcers, and vision problems. So individuals who are tested for inflammation, there's two different tests that physicians usually do with individuals, and the one is the CRP test and the other one is the Westergren test. So if it comes up that you have any inflammation, they don't tell you exactly where it is in the body, but it will tip them off that you have inflammation. So then they have to go on a little bit of a search and figure out what exactly it is, because inflammation can be the heart, it can be the intestines, it can pretty much be anywhere in the body. So they have to rule out and discover what you have. An interesting thing to note is that individuals can have inflammation in the eyes. They can have inflammation, as I mentioned before, in the skin and the joints. So when you're working with somebody, you really want to try and pinpoint what's going on and how they're feeling so you can change their program for that day. Typically, if somebody's in a flare and their symptoms are out of control, they're not going to try to come in. They're really not going to feel well. It kind of feels like the flu, but worse. So you won't have to worry about that, but you may have clients who call out because they aren't feeling well, and there's nothing really that they can do about that. They just have to wait until they get better. Also, hydration is very important for IBD. You want to make sure that your client is fully hydrated. Dehydration can actually make the symptoms worse, and if they go into a flare, it can make the flare up worse for that client or patient. Symptoms of IBS. So as I mentioned, some of the symptoms are going to be the same, but you're going to see how they're different. So with IBS, you have, again, pain in the abdomen. indigestion, difficulty swallowing, iron deficiency, nausea, gas, an urgent need to go to the bathroom, anxiety, depression, loss of appetite, cramps, and constipation or diarrhea, or a combination of the two. So you'll see how it's kind of similar, but there's some different signs and symptoms. So it's just important to weed them out and for the physician to diagnose properly. The causes of IBD and IBS. So there's not really an actual cause that somebody knows to be the exact cause, but there's different theories. So with IBD, genetics may play a part. There's some genes that have been linked to IBD, but there's no clear pattern. So once again, scientists, doctors are not 100% sure, but they're looking into genetics. Environmental factors such as high fat, eating high fat, sugar, refined foods, and saturated fats. Individuals in colder climates, they're looking at vitamin D as a possible cause because they're finding that the lack of vitamin D can actually lead to IBD symptoms. Psychological distress and emotional stress and anxiety. Then for IBS, you have gastroenteritis caused by a virus or bacteria, and that word again, stress. So stress keeps coming up, so we want to definitely work with that and try to bring stress levels down. Treatments. So for Crohn's disease, and you'll see a lot of the medicines are the same for both. Again, this is why it's tricky, and the doctors have to differentiate between the two. So you'll see nonsteroidal anti-inflammatory drugs, which relieve pain, decrease inflammation, and reduce fever. Anti-inflammatory, which prevents or counteracts inflammation in joints and tissues. Steroids, which modify or simulate hormones effects, often to reduce inflammation or for tissue growth and repair. Immunosuppressive drugs reduces the immune system. Vitamins. So some individuals have to take vitamins when they have Crohn's disease. Helps to promote normal body function, growth, and development because they're not always absorbing the nutrition like they should. Antibiotics stops the growth of or kills bacteria. And a lot of the same treatments you'll find on the other side, except for ulcerative colitis. People usually need iron and IV fluids. So as I was saying, hydration is very important because you could end up in the hospital and needing IV fluids, which can help calm a flare as well. But if the client or patient is already sufficiently hydrated, that's going to help when they go into a flare. Testing and diagnosis. So there's many different tests that somebody has to take in order to figure out exactly which condition that they have. So the first one is a colonoscopy, which examines the small and large intestine. The endoscopic ultrasound checks digestive tracts for swelling and ulcers. Imaging scan, a CAT scan or MRI to check for inflammation and abscess. The CAT scan may actually be done if you're hospitalized because they want to look right away to see what's going on or if they can tell from the MRI or CAT scan. So that one you may have done if you're in the hospital. Upper endoscopy, examine the digestive tract from the mouth and to the start of the small intestine. And capsule endoscopy, where you're swallowing a small camera that captures images as it travels through the digestive tract. Diet planning. So individuals who have IBS and IBD need to be usually on a specific diet, and it's important that all clients seek advice from a registered dietitian. So personal trainers, we can't give advice to our clients who have these two conditions because you're usually either A, not absorbing the nutrition like you should be, or B, your diet is so restricted at certain times that you need to make sure that you're getting everything that you need, vitamins and mineral wise and everything else, proteins, fats. So it's very important to seek the advice of a registered dietitian. So you want to make sure, clients want to make sure that they're eating 4 to 6 meals a day, smaller meals. They want to be eating slowly and do not drink with a straw. You don't want to have any or bring extra gas into the intestines. As I mentioned before, you want to stay hydrated. Urine should be a light yellow color. And you want to think about cooking simple. So it's either boil, steam, grill, or poach. And clients should be journaling to keep track of their foods that they ate and the symptoms afterwards. So that way, when they see a dietitian, they know, or even for themselves to connect the dots, okay, I ate this, this is how I felt afterwards, which is really important with catching which foods to eat and not to eat, especially because everybody is different when it comes to diet and IBD and IBS. So next we're going to talk about eating when somebody is in remission. So this is when the flare is gone and the person now feels better, symptoms are pretty much gone, and they're ready to go about their normal activities. So these different diets will actually be given to a person by their doctor or a dietitian, because you don't readily know which one is really going to work for each person. So it's kind of like you try it and you see, and then they may have to try a different diet if that doesn't work. So the first one is carbohydrate exclusion diet. So you're limiting or excluding carbs, fiber, and sugar. The Mediterranean diet, you're eating fiber, plant-based foods, olive oil, low-fat foods, dairy, herbs, and lean protein. The low fiber diet, you're excluding leafy green vegetables, nuts, seeds, popcorn, whole grains. The low FODMAP diet, you're cutting back on sugars, garlic, onions, chickpeas, and artichokes. And then the gluten-free diet. And some people may have to combine a couple of these diets and not just have one or the other, which again, you could see how you can get restricted on your diet pretty quickly by doing this. And next, we're going to talk about exercise, IBS, and IBD. So when you're working with a client, you want to be sure to be mindful that higher intensity exercise may trigger the symptoms because you have the intestines moving around. The intestines are already triggered by eating foods and things like that, so they're already moving. And then you start exercising and that gets them moving more and faster. So you really want to be careful of the different kinds of exercises that you give them. As I mentioned before, you want to do an assessment. So you want to assess and classify the client into a stress and exercise level. You're also looking at the quality of life, what symptoms they have, and how to manage those symptoms. So this is all the things that you're looking at when you come into contact with a client who has these different conditions. It's also up to the trainer to educate the client, to let them know that, hey, you need to bring your exercise intensity down if you want to feel better. Just letting them know what they should be doing. Obviously, if they choose to do something else or higher intensity exercise and they come back to you and say, now I have a flare, I'm not feeling good, they'll start to realize that by bringing the intensity level down to a low or moderate intensity, they'll still get results and they'll start to feel better. So again, you want to work with low to moderate intensity exercise, which can be walking or biking. You can also do low intensity weight training. So you don't want to go too heavy in the weights, more of like a moderate, low to moderate intensity. Aim for 20 to 30 minutes of cardio regularly, 4 to 5 days a week. Another idea you can use with them is doing yoga, taking Tai Chi classes, anything also to help get their stress levels down, because what's happening when you're exercising at high intensity, you're also cranking up the stress hormones, and we don't want to do that because that can throw somebody into a flare. So you really want to be careful with the exercise intensity. learning how to manage these symptoms and helping individuals to do that. So when you also look at yoga, you want to look to make sure that you choose more like a gentle yoga class, nothing that's like where you're holding poses for too long or anything like that. So make sure that it's gentle for them. Also, warming up and cooling down before and after classes or training sessions can also help. And just getting them, once again, to understand about hydration and the importance of being hydrated, especially before an exercise bout and after, so that way there's less chance of them being thrown into a flare. All right, that finishes the webinar for today. If you have any questions, there we go.
All right, so if you have any questions for Robin, you can actually pop that, I think, right in the chat. And I actually have a couple of questions. I never heard of alternate nostril breathing. So I had to Google that while you were while you were doing your presentation. And I'm wondering if maybe some of the some of their participants today would be interested in knowing how to actually do alternate nostril breathing.
Sure.
It's actually pretty cool. It literally is alternating your nostril. So it's, if you put your left hand, so maybe everybody at home that are watching, if you put your left hand on your leg and then you take a breath in.
And you're using your thumb.
You plug your one side and you breathe out that nostril, and then you breathe in and then you plug and breathe out the other side. So it's literally alternating, which is really interesting. I'd never heard of that before. So that's
you can also have your fingers like this, and you just place your thumb on your nose, and then your little finger goes on the other side.
Okay, so that's probably,
you're just alternating.
Yeah, awesome. And then you had mentioned also about one of the causes for IBD was potentially deficiency in vitamin D, which is interesting when you say it correlated with Canadians per capita had the highest incidence pretty much in the world. We often don't get a lot of vitamin D through our skin anyway, because of the wintertime, we don't get enough sun. And even if we're out in the sun, it's not strong enough to really stimulate that vitamin D synthesis. So, it makes sense that we would have issues with IBD if it's related to vitamin D deficiency.
Yeah, and then if you start getting the symptoms and you obviously test positive for one or the other, then the physician would start to give you vitamin D as a supplement.
Yeah. And then I was looking when you were talking about supporting our clients when they have flares, or even helping them not to have flares, I guess, when you look at types of programs that you would put together. So we want to keep that intensity down. So would you recommend, so if they're doing weight training, would you recommend maybe going to, 60 or 70% of what they normally would do, but maybe increase the reps? Like, what would you recommend?
Yes, you could definitely do that. You just want to keep the intensity down.
Right.
So it's not a high intensity. That's the name of the game, is keeping the intensity down.
Right. Because I know it can be a challenge for some people if they love going to the gym and they don't want to lose their gains. Right. They don't want to lose muscle or strength. So there are alternate things you can do, right? So you can take the weight down, but maybe do a few more reps. So you get a little bit more on the endurance side. And that would be really helpful as well.
Yes.
So I'm not seeing any questions coming in. So I don't know, is there anything else that you would like to share with us before we're done?
I think that's it. But if anybody has any questions, they can feel free to reach out to me. The other thing I did want to mention, I mentioned before about how people are embarrassed to talk about IBD or IBS. So I just like to stress that if you are putting together a program, definitely make a workshop or something so people feel more comfortable coming up to you and wanting to learn about that and how it can help them, because most individuals don't realize that we are able to help them. Everybody thinks, okay, I'm just going to go to the gym, it's just losing weight, but no, we can actually help with symptom management.
Right. And then the stress part too. What are some of the things that you could recommend to people who are listening to help their clients reduce stress?
So definitely doing the breathing techniques and doing meditation, guided meditation, different meditations. You can also, which is a really cool thing, especially now because everybody knows how to use Zoom or is on Zoom. If you have a client who isn't feeling well due to IBD or IBS, and usually they don't want you to see them at that point, you can go onto Zoom and you can actually do a meditation with them. So you're actually still getting your session in without having to lose it, but doing something different with them.
Right.
So working on breathing and working on meditation would be another idea.
And do you recommend too, for people that tend to be really stressed and are prone to having irritable bowel or some other gastro issues, before they even start to exercise, maybe to do some deep breathing and kind of put themselves into a more relaxed state before they start?
Yes, we also, with our courses, we do mention that. So somebody who is really stressed, yes, you can take their training session and maybe the first 10 minutes work on breathing or meditation with them before they go into their training session.
Yeah. It was interesting too, where you'd mentioned about journaling. I think that's so key and important. Not just to journal what they're eating, but also how they're feeling and any other symptoms they're experiencing. Because as you mentioned, that's a very good way to try to pinpoint what's going on. And they'll learn a lot about themselves as well.
Exactly. Because then when you see the dietitian, you go in and, they say, well, how did you feel? And you didn't write anything down, you wouldn't remember. And then it's hard to figure out exactly on that end, like what you should be eating, shouldn't be eating.
Absolutely. Actually, I never even thought of that. I was thinking more for themselves, but that's a great record to take into their physician or healthcare provider, just to let them know as well what's going on. Wonderful. Well, I want to thank you very much for that informative talk, Robin. That was wonderful. And for folks that are interested in learning more about Robin's stress management programs, you can take a look at www.medexin.com. She has 3 programs: Mind Body Medicine Specialist, I'm going to get it wrong, Holistic Group
Fitness instructor,
and stress management, holistic stress management consultant, right?
Yes.
So, and something for everyone. So you've got some for people that are personal trainers, healthcare professionals. The Mind Body Medicine Specialist is a fantastic program for group fitness. The Holistic Group Fitness Instructor, she teaches you all kinds of interesting things. You use different modalities, for example, essential oils, different stretching, really how to put on an amazing, relaxing class, reducing stress for your clients. And then if you don't have a fitness certification, but you're really interested in working with clients and doing stress consulting or stress management consulting, then the Holistic Stress Management Consultant Program is a really great one to take a look at. All right, so I guess that's it. So thank you very much for everyone for joining. And the replay will be sent out very soon. All right, thanks for joining us, Robin.
You're welcome. Have a great day.
All right, bye-bye.
Bye.